seconds. Thank you very much. I call this meeting May 26, 2020, a regular but remote meeting of the Burlington Board of Health. Board member. I'm sorry. Board member Libby Wallenjevich, would you please represent everyone here in reciting the Pledge of Allegiance?
Thank you, Mr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Mrs. Wallenjevich. I am Ed Weiner, and I'm chairman of the Burlington Board of Health. We are remote. Board members with us this evening are David McSweeney, Vice Chair, Wayne Saltzman, and Libby Wallenjevich. Board member Mary Beth Welch is not with us this evening. Also, I have Susan Luminello, Director of Public Health. Is Christine on this evening? I know that she's been ill. No, she's not. Dawn Cathcart, our recording clerk. Sarah Kodamash from our Burlington Board of Health Administration. And we have a number of visitors with us also this evening. We are operating in a declared state of emergency with special rules. Our Vice Chairman, Mr. David McSweeney, will provide the legal requirements for tonight. David?
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by turning into BCAT, Government Cable Access Channel, the BCAT Government Meeting Facebook live feed, or over the phone at 408-418-9388, meeting number 710-535-478. That's the toll-free phone number 408-418-9388, meeting number 710-535-478. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address. And as a reminder, all votes are required to be done by roll call for virtual meetings. And with that, I'll turn it back over to the chair.
Thank you very much, Mr. McSweeney. Again, please note that we're live on BCAT and available for comments and questions through this video technology. Next order of business is approval of minutes May 12th of 2020.
I make a motion.
I have a motion? I have a motion. Do I have a second?
Second.
David McSweeney seconds. If there are any comments, corrections? If not, I'll take a vote. All in favor, and I will roll call. David McSweeney.
Aye.
Dr. Wayne Saltzman.
Aye.
Libby Wallenjevich. Libby, are you on mute?
Aye.
And I'm Chairman Ed Weiner says aye. So it's 4-0. Thank you so much. The next is citizens' time. Sarah, do we have anybody who is on, who is not on the agenda, who would like to speak to this board?
We have some other participants in the group, but I'm not sure if any of them are speaking for citizens' time.
If you're a citizens' time, please wave or make yourself known. see none, so we will go on to Chairman's report. As always, I have a couple of thank yous and a couple of things that we need to do. These times continue to be extraordinary. Our town has and continues to face and continued and new challenges each day, sometimes each hour. But as I've said a number of times now, I'm proud that we are meeting all of these challenges head on, using plans that we developed and drilled and practiced months and even years ago, while also employing novel and innovative solutions. Our Board of Health, our staff, and Medical Reserve Corps continue to work every day to ensure public safety. I have read all of their names a number of times, and I thank you again now for your commitment to this town. Before we begin, I have to again say something about our staff. They have just been outstanding. Our many volunteers and elected Board of Health members, and I'll just those names again tonight as David McSweeney is here, Wayne Saltzman, Libby Wallenjevich, and Mary Beth Welch. I also want to thank our Director of Public Health, Susan Luminello, who has provided the highest of leadership to this town. I also want to thank our town administrator, Paul Sagarino, who has led and coordinated, along with Susan, so many initiatives as they lead this community. And to this leadership, I also want to add the great and important work of our town clerk, Amy Warfield, who has done so much over these weeks. I talk to all of them multiple times a week, and I'm sure each and every one of them are totally sick of me by now. And last, our town is so blessed by a Medical Reserve Corps, their volunteers that have provided so much outstanding volunteer service to the town of Burlington. Thank you so much. One other thank you is to Dr. Wayne Saltzman, who has done, Wayne, how many presentations have you done on Fridays now?
I just did my 12th one on Friday, last Friday.
12 presentations to update this community. Thank you so much, Dr. Saltzman, a noted physician and member of this Board of Health.
Thank you, Mr. Chair.
You're welcome. Now I'd like to move on to subcommittee reports. We have a subcommittee report, which I would very much like to hold until we discuss our town election plans. So let's move on then to applications. And we have one application this evening, and that is 5 Arlington Road, the keeping of animals, 6 chickens. That'll be presented by our Director of Public Health, Susan Luminello.
Yes, thank you, Mr. Chairman. So Mr. Larzui, is here for a permit for the keeping of 6 chickens. Samantha Hardy, our Associate Health Inspector, went out and did an inspection last week and looked at the coop, and it meets all the requirements, and she recommends that the board grant the permit.
Mr. Chair,
we have
class coop I have seen of late. I would make a motion to approve this request for license.
Second.
Are there any other comments? I don't want to go afoul here.
The only question I have, Mr. Chair, are there any abutters? It does, and I agree with Dr. Saltzman. It's a fine-looking coop, probably one of the better ones. Are there any abutters that are here to wish to talk in favor or against it?
This
Oh,
is
great.
Susan, and we haven't heard from many of the abutters either. So we did send out letters to each of the abutters, and didn't hear anything back from them.
Awesome. That's great. Thank you. That's all I had.
Mr. Larzui, do you have anything you'd like to say to the board?
No, I'm fine. Okay.
Okay. If there are no comments and any other comments, I'm going to put this to a vote. All those in favor, and I will do a roll call. David McSweeney,
Aye.
Dr. Wayne Saltzman,
Aye.
Libby Wallenjevich,
Aye.
and I vote aye, 4-0-0. Mr. Larzui, we thank you very much for coming on. Thank you for doing the right thing and applying. And our Director of Public Health will be getting back to you with a permit. Is that correct?
Yes, I will be sending a permit out through the mail, and then you'll be hearing from us when it's time to renew that permit in a year. We'll be coming out to do another inspection.
Okay. Thank you very much.
And just as a reminder
Thank
too,
you.
you can't get any more than 6 chickens.
Okay. Yeah. Yeah. Sure.
And no roosters,
Yeah.
as
Of
you
course.
know.
Yeah.
Okay. Thank you so much. You're
Thank you.
welcome to stay here online, but you're all set. Thank you so much.
Okay. Thank you very much.
Okay. Uh, okay. We're going on now to one of the most important discussions that we have had in many years. We have first town election plans, and we have scheduled to speak to tonight the town clerk, Amy Warfield. And we also have town meeting plans. We have the town clerk, Amy Warfield, and our town moderator, Mr. Bill Byer, Mr. William Byer. So do we have them both on this evening? I know, Amy, you're on. I can see you.
Yeah,
Is Mr. Byer on?
I have not.
I don't hear. Okay. So, Susan, do you want to lead this discussion by first giving us the background around the role of the Board of Health on town elections and what we have been talking about and our subcommittee discussion? Why don't you do that first, and then we can have Dr. Saltzman go over a quick report, very short report, very quickly. So, Susan, please.
Sure. So we had a subcommittee meeting to discuss the town election plans at the request of the town clerk. We went over the town clerk's plans, which are included here. She is coming to us as a courtesy, just to ensure that she is in the town, is taking all the precautions that they need to take to adhere to the governor's social distancing requirements. The Board of Health really has no role in this, more just to say, to make an approval of the plans, because the town election needs to go on either way in a manner, and she's trying to do it in the safest manner as possible. So I did include some recommendations for safe precautions for voting, and I sent those to the town clerk, and she's gone over them. And I think she believes she has hit on pretty much all of these bullet points. And she has included her plan for what the town election will look like. So I don't know if you want to go over the plans, Amy, your diagrams, and maybe Sarah can put them up so that the board and the people at home can see them.
Sure.
Sarah, do you have her plans? There they are.
If you can
They're up,
actually go,
Amy.
if you can go to the second one, Sarah, first, the second page, or the image 2, I think it says.
There's only one image for the election PDF.
Okay. I had sent two. One has a bigger drawing.
Is that
This is the only one that we have seen.
Oh, okay.
I believe the first one is in the board's packet. So it's on page 3
Okay.
in our materials. So the board should have it in their packet. And it
Okay.
should be, Sarah, it should be in the online.
Let me see. Let me see. I have see if I'm corrected.
So it's showing, Amy, you mean the one
Yes,
that's
it is.
wooden gym and the rubber gym,
Yeah,
correct?
basically,
Yeah,
it's showing the two, the kind of the break. This is the detail for the rubber gym, the gym that we normally use. We will be putting 4 precincts into that gym and then 3 precincts into the wooden gym. And so
Yes,
the layout per the precincts are the same, really. The total width between the two blue dotted lines is 20 feet. So there's ample room for people to be able to be walking around without being within 6 feet of each other. Our plan is that we will also on the floor mark all these spots, and voters will be directed that when they come into the gym, they will go to this first spot called the hold spot. If there's somebody at the check-in spot, which is where the first red star is, they will wait in that hold spot. And then they will progress from where that red star is to the end of the table, which is 6 feet. Actually, with the tables, it's actually almost 8 feet. They will pick up their ballot at the other end of the table, and then they will go to the hold spot if any one of these 3 voting booths is filled. If there is an open spot in the voting booth, they will go to the voting booth. Each of the voting booths will only have 1 open booth. So there will be basically 3 voting booths for people to vote at. Then they will hold at the voting booth until the checkout spot, which is the red star down at the bottom of the precinct, until that's empty. And then they will be able to move out, move in, check out, put their machine in put their ballot in the voting machine, and then they will leave the precinct. So that's kind of the flow that we're going to do for every one of the precincts. The other piece that you have shows outside, we will be having people that are making sure that people know what precinct they're going to before they go in the building, and that there will be a team of people that will be alerting when a particular precinct is a hold spot is available in a precinct to be able to move another voter in. So they'll be lined up outside, just similarly to how they are at the grocery store. We will have blue tape on the ground. We'll have signs, a lot of signs that will show people where to stop, where to wait, and when to progress on. As normal, we usually have a police officer inside and 1 outside. So for police details, I will have 1 police officer in the rubber gym, 1 police officer in the wooden gym. And then I will have 2 police officers outside helping with directing people, and 1 police officer directing traffic with a staff member that I have that does traffic all the time for us. Any questions?
Bathrooms. Mary Beth asked today about how we're going to handle bathrooms between people who go to the bathrooms. Are you deploying a custodian there?
Yes, we always have a custodian on staff there during the election. That will be one of the things that they will have to remain down in the area more for this particular election. The bathroom would be, as you're looking at the charts that's there, the bathroom is over on the far left-hand side, out in the area where it says 4 precincts, 5 and 7. It's at the end, basically that's a hallway and it's at the end of the hall.
Do we have any other? Well, before we do that, Dr. Saltzman, would you quickly summarize the subcommittee meeting?
Yes, Mr. Chair. You, Susan Liminal, and Amy Warfield convened to discuss these plans. I think as Director Liminello said, the role of the Board of Health is not to dictate whether or not the voting occurs because that does not fall under our purview. But we can make recommendations to make sure that our community and the poll workers are as safe as possible during this event. And we talked about a number of things, including this plan, the line maintenance or monitoring to get in, the maneuvering of folks across this plan. And the conclusion of the subcommittee was that this plan offered a safe means by which folks could vote while maintaining COVID precautions, with the understanding that given statistics for other towns, about a third of the voters that typically turn out for these local elections would be coming to through the school, which would be about 1,000 people. So our conclusion was that this plan was a sound one, and we were 2-0 plan.
Thank you very much, Dr. Saltzman. Does any other of the board members or staff have any other questions? If not, I'll open it up to anybody who is here on the line.
Mr.
Chair?
Chair,
Go ahead.
Oh, sorry.
Go ahead, Susan. That's fine. I'll go after you.
I have a question for Amy because we didn't see this plan at the subcommittee meeting. I'm wondering why the line is snaking the outside line the way it is instead of going the other way up the sidewalk. My only concern with this is people exiting and people waiting in line. So you have people crossing in that direction if the line is long. And why not have the line go the other way?
Do that, but there is no sidewalk there along the wooden gym. There's parking area. And there's a grass area between the building itself and the parking area. The only place where there's a sidewalk is where I have that line. I could most certainly mark it off and do that. I've got a lot of cones and a lot of sawhorses from DPW. So if you would prefer that we do it that way, I'd be glad to do it that way.
I'm just thinking of the cross traffic there with people exiting and people waiting in line.
Yeah, I understand. My concern was the fact that this parking area is the handicap parking area. And so I've got to be careful how much space I take out of it. But I can do that. That can be done.
Thank you. David McSweeney, you had a question?
Yeah, thanks, Mr. Chairman. Actually, a comment and then maybe one question. First of all, Amy, thanks for taking the time and dedication and commitment in the subcommittee as well of pulling this together. These things, as simple as somebody from the outside looking in thinks they're easy, there's a lot of details that need to get hammered out, and this plan is very thorough. So thank you for pulling this together. It's an important day for Burlington. So thanks. My only question I guess I have is more along the lines of if a resident shows up and they're not comfortable with the environment, or they get in and they're not comfortable, do we have a way for them to complete the voting in a different manner? And/or have we thought about that? Is there somebody to maybe answer their concerns, or we can take them on an exception basis? And I'm assuming the answer is no, but it's just something to think about, because I'm not sure once somebody gets inside if they're concerned or not comfortable, how do we handle that?
Well, there's always we always have up front in an area, we have a standalone booth that we use for what's called a provisional ballot. and that is for someone who is not properly qualified to vote, meaning they weren't registered in Burlington in the time frame, or they were inactive and they failed to have the proper identification to vote. That is a standalone booth by itself. And what we could do is offer that to somebody if they wanted to. It would then entail, when we do a provisional ballot, they have to fill out a document. We wouldn't make them fill out that document, but it does require the warden from that precinct that they are in comes over, they place the ballot in the booth, they step back and they let the person vote. And then the warden takes the ballot back to the booth, back to
Gotcha.
the precinct with them.
Yeah, I mean that makes sense. That's reasonable. Again, you don't necessarily need to solve for it here, but just something to think about, that the
Yeah.
best made plans don't always go as smoothly as we think they're going to go.
Yeah.
And that might be a circumstance like that we need to
Yeah.
deal with. So
Yeah.
thank you. And again, thank you. There's a lot of, like I said, it seems easy to pull something like this together, and I know there's a lot of work involved in this, so I really appreciate your commitment in getting this done.
No problem.
Mr. Chair.
Yes.
Mr. McSweeney brings up a point that I just want to segue from. The things that may fall out of the norm or may make folks uncomfortable. Um, voting is one of the greatest abilities that we have as citizens, and I've talked to my updates about being good citizens, wearing masks, social distancing. I just want to make sure that our folks who come to the polls understand that the poll workers who are there have also been updated on this plan, and they have been or will have been taught how to make sure that we're optimizing all of our Board of Health concerns for the safety of everyone. And so I would urge um, our community members who come to the voting booth to adhere to the rules that the poll workers may be going by, and to have patience, as this is a first for all of us, but that everyone is geared to making this the safest and most productive and positive event that we can, given the circumstances. So I put that plea out to our community.
Thank you. That's
I have just two comments. The first is you've covered much of this during the subcommittee meeting. People with certain disease states who can't wear a mask and we're urging everybody, if they possibly can, to wear a mask, and if they can, to please vote early. But if somebody does show up, would you let everybody know exactly what you're going to do?
Well, we are using the guidelines for the social distancing for 6 feet. So everybody is going to be held to working inside those steps. All of the workers are going to be required to wear masks and gloves all day. And so if a person does come in who cannot wear a mask, we will try and provide, either by using like I said, the provisional ballot booth, or provide them a time when they could come and walk through, vote without having other people, possibly near them or whatever.
Thank you. And then the last was, and we talked about this, usually election day is some of the most greatest days we have in this town, because we get to see people we don't get to see. We get to shake hands. We get to kibitz. We get to do everything. And this is going to be very different. Just please comment on that. So if you say hello to a poll worker and they kind of wave and say next.
Yeah. I'm taking a lot of the guidelines that Susan sent, and I've put them into a document that all the poll workers will be given. and reminding them constantly that yes, unfortunately, this is not going to be the normal social time that that elections do, or especially town elections allow us to have. So, you know, as poll workers, you're going to be held to a high standard, and yes, you may need to move people along and say, you know, nice to see you, move on. You know, now go to the next station. That's another reason why I'm having a police officer in each of the gyms, so that they will be along the back side and to encourage people to keep moving on. That you know, it's not appropriate to be in here socializing, that unfortunately at this point in time, we just don't have the room, the capacity to be able to do that. So yeah, it is going to be, and you know, it's going to be very different for my election workers in terms of that level of interaction.
Thank you very much. Is there anybody who is on the line here or who has dialed in and we can see certain people's name here? If they would like to comment, I'd like to open that up to anybody who would like to say anything. If not, Susan, I believe that we do not need a vote here. This is a discussion. Is that your interpretation as well as mine?
Yes.
Okay. I want to thank you. Thank you very much.
Thank you.
We're going to do the best we can. People need to be patient. People need to understand that nothing is 100% safe, but we're going to do the best we possibly can to keep every voter away from harm. Nobody else, last chance to comment. Then we will move on. And this is the topic which is even more difficult, and that is town meeting plans. Again, we're representing the Burlington Town Clerk, Amy Warfield, and I'm hoping that our town moderator, Mr. William Byer, is on the call too. Mr. Byer, you on the call? I'm sorry, I guess he's not.
His name is there. He's on
There,
mute.
he's muted.
He's muted. Can you take him off mute for 1 second so he can say hello?
You're off mute.
Oh, I'm here, yes.
Thank you. I just wanted to acknowledge you. I have spoken to Mr. Byer multiple times, and thank you very much for your for being so smart and for doing what you're doing. So thank you so much for all that you do also. Again, I'm going to ask Ms. Luminello, who is our Director of Public Health. The Board of Health has a different role here and different ways of handling this. And I will talk to Susan. Can you please talk about our jurisdiction?
Sure. So in the meantime, Sarah, can you put up Amy's plan for the town meeting? So I've included in your packet a few things. One is a copy of the governor's order number 13, which sets the limitation on gatherings. If you look at section 4A of that order, it states that it does not apply to municipal legislative bodies. So that's what the town meeting is. It's the municipal legislative body. So this order does not apply to that. So with that being said, however, I've also included in your packet a memorandum from the attorney for the Massachusetts Association of Health Boards, Cheryl Sabara. And it's I believe it's a 4-page memorandum. But if you look at the Board of Health role in that is outlined pretty clearly in a paragraph in that memo. And it states that the Board of Health, the role of the Board of Health in postponing a town meeting is somewhat limited. While the moderator must confer with health officials as part of the scheduling process, there is nothing in the statute to require the moderator to accede to the wishes of the Board of Health. However, if the Board of Health reasonably believes that holding a town meeting could place the attendees in a position of danger, and the moderator refuses to postpone, then the Board of Health can exert its statutory powers. So after reviewing this plan, however, I do not believe that it's going to place the attendees in a position of danger. The spacing is all 6 feet apart. The only thing that does not concur with Department of Public Health guidelines for an outdoor event is the tent that is placed over the meeting members. So as you can see from the diagram, it's showing 180-foot by 60-foot tent. So other than that, that is the only thing that does not make this a unconfined space. So that it's up to the board now to decide if they believe that this board can either agree or not agree and decide whether or not they feel that this type of gathering would place the attendees in some kind of public health danger here. I do not believe that it does because, again, it is in an outdoor space, and the only thing that is not conducive with what would be allowed now is the placement underneath a tent.
Please, people who have some questions for Amy first. Why don't you walk people through, Amy, with a couple of quick issues concerning. I have been asked a number of times now about what are we going to do about bathroom facilities and how they are going to be washed and sanitized at the end if you're going to have them. And then the other question I received that I have not seen is where are you going to have A, the public, and B, people who have to support their budgets.
Well, I'd like to weird. I would like to just introduce one other person that has been is attending the meeting here, and that is John Porter. John is the AV kind of guru that we have working at our high school, and he's the one that actually created this drawing based on what was I had said were my needs or our needs for town meeting. So I think if you want to have somebody walk through the diagram, John would be a better person to do that. But I defer to Bill Byer and let Bill also talk about some things that we've been talking about as well.
Either Bill or Mr. Porter. Either of you want to speak?
Well, I'll let Mr. Porter speak to his diagram. I have worked up some layouts that are very similar, but fortunately his graphics are a whole heck of a lot better than mine. So because there's so many similarities, if I'll just let him go ahead and speak about his.
Is Mr. Porter on mute?
He is not.
Is Mr. Porter here?
He is.
Well, Bill, I guess you're going to have to.
Yeah. It looks like he's speaking, but it's we can't hear his audio.
All right. Well, I'll do my best off of this. As you can see with this diagram, where we have on each side of we have the AV equipment in the middle, along with the moderator and the clerk. And then on either side are like 4 sections of seats. Each section has, or each row in each section has 2 seats, which would be 6 feet apart. Then there would be an aisle in between them. And my thought would be that in the aisle, we place microphones on stands. We would have a number in 3, maybe 3 in each aisle, so that people would be no more than 15 feet from one. But they'd be on a stand, they'd be on, and they wouldn't be touched by anybody. They'd just be sitting there for people to use. So we would not have to worry about our typical passing microphones around as we do it at town meeting.
Thank you. And I have a number of questions, but please, any of the board members would like to make comment?
Mr. Chairman,
Yes.
I just have a question for Mr. Byer. I noticed that the very first row and the very last row, well, no, the last row is okay, but how are the people in the very first row going to get out to speak? Because, you know, the dotted lines serve 2 rows, but there's no dotted line there.
Actually, that's a good point.
This is John Porter. Are you able to hear me now via phone?
We can, yes.
Okay, I apologize. I'm not sure why you were unable to hear me through the headset. I'm glad to answer any of the questions directly about the diagram that I've created if Bill wishes to have me do so.
My response to that question is we'll have another row of microphones on the outside.
Okay. Okay. Thank you.
Mr. Chair, I have a question.
Yes, please.
So I'm concerned about folks checking in and then indiscriminately looking for chairs and the potential for some huddling and closer exposure than what we're aiming for. Although it will be prolonged exposure, I understand that, but I'm interested in having more purpose in seating, and I don't know whether that means assigned seating or specific seating based on alphabetized last name, etc. But I would like to have to make the aggregate a little bit more purposeful than just coming in, checking in, and taking a random seat.
I had thought about that, Wayne, and one thought that I had was we'll just start at the front and have people sit down. We're not going to give them options as where to sit. As they come in, we'll put them in a chair.
Okay.
And Dr. Saltzman, the other piece with that is I'm going to have 3 stations where they sign in at. We won't have just the one line. So we will have 3 stations broken down alphabetically and again, we'll have 6-foot lines for them to, you know, stand behind and go from there in terms of getting them signed in. And then, as Bill said, I think having them just telling them that they've got to go to the, you know, the next available seat, we can have some more people that are ushering people in, basically.
No, thank you both very much. I appreciate that. I want to make sure our community watching understands that I'm not preaching infantilism,
No.
but I am saying that you know, we're trying to optimize safety, and we have to have some modicum of conduct in order to do that. Especially as our legislative body is a role model for the rest of our community. So thank you for those considerations.
And also going along with that, I'd like to reiterate too that, I mean, anyone, most people, I think, should at least consider wearing a mask in terms of getting in and getting seated. And whether they feel comfortable leaving it on during town meeting or not, that is up to them. But yeah, while they're possibly passing people and things like that, that wearing a mask is just a good, public health behavior.
And if I can respond to that as well, I completely agree with you, Amy. I would like folks to at least be masked if they can,
Yep.
coming in. And once they sit down, I would have no problem from the doctor point of view of having folks take off their mask, given the distancing and the outdoor environment and what we know about transmission potentially of this virus. So I think that's a really great point.
I have a comment. What about the microphone heads that they're speaking into? Should they wear a mask when they're speaking into the microphone?
Yeah, I would. So I would offer that should in fact be the case. But I think Amy's point was when they're sitting down,
Right.
having to wear a mask. But I consider using the microphone the same as talking to a person in front of you. So and I think that the same conduct for standard precautions that we should now be very used to after 3 months should be taken into account under that circumstance.
And I usually do send out, and we're in the process of sending out a number of notices via email to all the town meeting members. And going along with the document that Susan sent me even for elections, that's something I can certainly add into one of the emails that I send out to the body to say, this is kind of, what we are expecting of you all. To do as just, again, good public health behaviors.
I want to point out that in the Be Safer precautions for town meetings, it says, and as of May 6, 2020, wearing a mask in public is mandatory. Although, and I just want to emphasize, it's unclear if that's true for individuals who are acting in the capacity as town legislatures. And you should probably check with town council.
Yeah.
I urge you to check with town council because all throughout this document, it says that people should be wearing masks.
Yeah.
Although if they're town meeting members, we may not be able to enforce it. So I urge you to consider having everybody wear a mask and let them possibly take it off to speak if necessary. But I'm just looking at the document that came today, and I would check with town council. If not, if you would like the Board of Health to check with town council to see if that's true or not, we can, Susan.
Yeah, I have no problem with reaching out to town council on that matter.
I mean, I don't understand why we wouldn't have everybody wear masks, and if they come up to a microphone, it is what it is. The majority of people who are town meeting members, I shouldn't say the majority, but a good number are senior citizens who have been in town meeting for a very long time and have given of themselves. I don't want to say anything negative because they do so much, but it is a disease of people who are our age.
Yeah.
So I urge you not to say take your mask off. I'm not sure we can enforce that as I see here, but I urge you as chairman of the Board of Health for everyone to wear a mask. Where are you going to place guests again? Guests and people who have to support their budgets.
Well, anybody that is speaking in terms of for a budget would be over at the table that is at the top of the drawing there. Right now, it's labeled with Ways and Means, Administration, Selectmen, and School. But as we all know, those offices don't have to stay there the whole time. So that's kind of going to be our presenter area, as well as this one podium that we have that's got guests at it. Now, those people will be waiting off to the side. They will not be in the tented area to begin with.
And what the other question is nobody has really, maybe I missed it, and bathrooms, are we gonna have porta potties?
That is something that I've been talking about with the schools. Apparently there are some facilities there, but, you know, in the locker room area. But, if we need to, we were going to rent porta potties.
Again, we would need someone to disinfect them after each person,
Correct.
okay?
You would
And
also need, oh, sorry, Mr. Chairman, that hand wash station for if you're gonna have porta potties. Or
Okay,
some people to wash their hands.
okay. And can it, Susan, can it be the hand wash stations that are, like, Purell things, or does it have to be water and soap?
Preferably a water and soap type of station rather than a Purell station. If you can, I mean, we can work on that, Amy. See, I think the ideal thing is if you can use the facilities there, that's the best. You know? I did have a question about the tent. How high is that tent?
So this is John Porter. Are you able to hear me well now?
yes,
Yes.
So the sides of the tent range from 8 to 10 feet off the ground. There are no sides on the tent, no doors, no coverings at all on any of the 4 sides. So all sides are completely open to airflow. So folks who are entering the tent would find themselves entering under the edge of the tent, which would be about 8 to 10 feet off the ground. The tent is a pole-supported tent, much like a circus tent, and so there are multiple poles within the tent that hold up the roof, and the height of those poles can be quite high. It can be as much as 30 feet off the ground. That aids in airflow through the tent. It also aids in rain being able to run off the surface of the tent if there should be any precipitation that day.
and what time will the meeting begin? I haven't, Mr. Byer.
Well, that's, it's up for discussion at the moment. The reason for a tent was if we had it on a Saturday, say a Saturday afternoon, we wanted people to have protection from the sun. There's another alternative we're considering, and that would be to do it in the evening, maybe starting at 6 o'clock, in which case we wouldn't even need a tent. We would just have seats out in the football field.
Can I speak, Mr. Chairman?
Sure, please.
Mr. Byer, my only concern with an evening meeting is that it transcends dusk and nighttime. And the concern here would be mosquitoes. Now, I don't know how active they are at this time of the year, but I think it's a consideration.
Mr. Chair?
We urge everybody not to be out during those times.
Yes, Dr. Saltzman, was that you?
Yes, please, Mr. Chair. I'm compelled to go back in our discussion a bit, so forgive me regarding masks. So I just want to make a point of clarification and make sure that I am aligned with what the director believes as well. It was my understanding that per the governor's order, people must wear masks whenever they leave home if they can't maintain a distance of 6 feet away from others. And that masks were only required in grocery stores, pharmacies, retail stores, public transportation, etc. So, given the comments that you just made about, I'm concerned about pushback. I just want to make sure that I have the correct understanding of the governor's order for wearing masks in public, because I have a feeling if we go along with everyone should we are wearing masks during this process, folks may have a different understanding. So, Director, am I correct in what the governor's order was?
Yes, that's correct. And
Yeah.
we could also add to that, if you have a medical condition,
That's right.
not
That's
be able to wear a mask as well.
That's right. So, Mr. Chair, my point is, your comment was that folks should be wearing a mask throughout the process. I'm afraid that might get pushback to the board regarding what the governor's orders actually are. And so I go back to standing by what Clerk Warfield said, and then my chiming in as well, that if people while sitting after they have reached their seat and everyone is sitting and social distancing is maintained, that people can take off their masks.
Dr. Saltzman, I'm quoting from the document on page 2 on be safer precautions for town meetings. And I just quoted the area. I quoted the 2 sentences for us to check with town council.
Okay.
That's what I'm quoting. I am not making anything up here. I am reading off of the state document.
Just as a
I just
clarification,
want to be able to say that before we get phone calls, regardless, I just want to make sure that at least we have for the record that we do have an understanding of what the governor's orders are in case town meeting members are compelled to call
And I realize that this is from the lawyers of the BCBOHA document.
so Mr. Chairman, just as a clarification, that is not a state document. So it is, so I'm not, I cannot say the accuracy of that statement. This is just to be used as guidelines for ideas for questions to ask. I can't verify the certainty of that statement. So, I mean, I think it is better to go by what we know of the governor's orders at this time.
Okay. I just want to keep people well. I saw early on, there were some town meeting members on this call. I thought I saw Mildred Nash on this call. Is she still on? Would she like to make comment, or are there any town meeting members on this call who would like to speak? Is she still on? I can't tell from my view here. Sarah?
It doesn't appear so.
It doesn't appear so. So there's no one else on this call. I have full confidence in Amy. I have full confidence in Mr. Byer, and I have full confidence in this board and Susan. I'm just going to ask that Susan, please keep in touch with Amy and Mr. Byer. Bill, stay in touch. You and I can stay in touch. If you need the Board of Health to assist you in anything, we are here. That's what we do. Feel free to call me. I'm enjoying speaking with your wife every time I call. But really, please keep in touch. I think we can make this happen. And I'm very proud. I'm very proud of our town officials. I really am. I'll leave it. Is there anybody else who'd like to speak at all? Any final comments?
I have a couple. One, I have been impressed with the work of Susan and the board over these issues, and I just like to thank you for all your efforts. And at the beginning, Susan talked about the role of the moderator and the board, versus the jurisdiction. Let the moderator be very clear. He will only do what you folks think is in the safety of our town meeting members. So I am looking for your guidance and your input all the way through this. So if there is at some point a list of recommendations or requirements for that you think we should be having implemented for the town meeting, I'd be more than happy to see them and probably more than happy to use them.
And we're very fortunate to have you as moderator. And very fortunate to have Amy as our town clerk. If there's
Well-
nothing else, any other final comments? This has been a great discussion. I
Mr.
feel very comfortable.
Mr. Chairman, the board may want to take a vote on this one, just as a vote of approval of the plan as it's presented to them tonight.
Mr. Chair, in that case, I'll make a motion to approve the process for a town meeting as outlined in this diagram and as discussed by Clerk Warfield and Moderator Fire.
I'll second that.
I have a motion and a second. Is there any other discussion? If not, I'll put it into a vote. Mr. McSweeney,
Aye.
Ms. Wallenjevich,
Aye.
Dr. Saltzman,
Aye.
and Chairman Ed Weiner, aye, 4-0. Again, this is a vote of confidence, and we appreciate it. And there'll be more discussion here. I'm sure there'll be more discussion, but I think we're well on our way to getting it done. And Mr. Porter, if you're still on, thank you so much for your help. Thank you very much.
Thank you.
I guess we're done for that particular,
Mr. Chairman?
yes.
This is Amy, if I can just say one thing. I also want to thank the board not only for the support on this matter with town meeting, but also your support with the election. And I really do appreciate the concerns that you all have for the public and the support that you've given us in terms of kind of figuring out the best way to keep everyone as safe as we possibly can. We can't avoid everything, but I really appreciate your insight and your help with these two matters. Thank you very much.
You're very welcome. Thank you so much for joining us. You're welcome to stay, but I'm sure you have lots of other things to do.
Yeah, like dinner.
Our next discussion is another vote, and it's the reorganization of the Board of Health. We have, it is almost June, and we usually reorganize in April, and we have put this off quite a while. And I thought before we go on our actual summer schedule, which begins in June, the last Tuesday in June, we'll be meeting, that we would reorganize and not let it go until midsummer. Most other boards, or at least the school committee, has reorganized, and I'd like to get that off our plate. So with that, does anybody have any nominations for
Mr.
chairman?
Chair, I am privileged and honored to nominate Dr. Ed Weiner as the chair of Board of Health.
I will second that.
Now, I guess I have to have the vice chair ask for the vote.
Oh, I guess you're right? Wait,
We
So
have
we
a
have a-
motion.
we
and
have
you
a motion and a second. Okay. Is there any discussion?
I'd like to formally say how privileged we have been to have the leadership of Dr. Weiner for this past year, especially with the stresses that have been placed on the entire town. Given the COVID-19 pandemic, Dr. Weiner has really exceeded any bar that I can think of for any chairman of any committee in helping to maintain organization and calm during this time. I appreciate his leadership, and I can't think of anyone better to help us continue through this crisis as we hopefully approach normalcy soon. Thank you, Dr.
You're
Weiner.
very kind.
And since I'm holding the chair for 1 second as I coordinate this vote, I do also want to say, and I said this once before, and this comes from the bottom of my heart, not only have been a leader on this board and for the Board of Health, you've been a leader in the town in so many different ways. And it's not just on COVID, it's just every issue that comes before us. You manage it with passion, dedication, and commitment to getting to the best end result. And I've learned a tremendous amount from you, and am honored. I'm assuming that the vote is going to go through. I'm honored to have you as my chairman for the next year. So thank you again.
And thanks, your dad.
All right, so I'll take a vote. Dr. Saltzman.
Aye.
Libby.
Aye, with pleasure.
And Ed, you can vote for yourself as well.
I guess I'll vote aye.
And
Narcissism.
yeah. And I vote aye as well. So it's 4-0. Congratulations,
Thank you
Ed.
very much.
Thank you.
Thank you. Thank you very much. Now I need nominations, please, for a vice chair. Do I have anybody who will nominate?
Mr. Chair, a young man who has proven himself worthy of leadership of this board, I feel should continue on as the true leader that he is. I would nominate David McSweeney to continue as our vice chair.
Second.
I have a motion to second. Is there any other discussion or any other nominations?
I'd like to also acknowledge David McSweeney. He's really stepped up to the plate this past year in helping the board navigate through some of the more challenging proposals that have come before us, especially with regard to sites and development, and being willing to be on subcommittees, despite being a leader in his own, for his own company. So, David, thank you very much for your time and energy, and I look forward to working with you again in your role for the next year.
Thanks, Wayne. Very humbling, very kind. Thank you.
And I'd like to also echo much of that. You've been a terrific vice chair. We talk all the time. You're at every subcommittee meeting involving development. We're very lucky to have a professional that you are, and thank you so much.
Thanks, Ed.
With that, I'll put it to a vote. Libby?
Aye.
Wayne?
Aye.
I'll vote aye. And David?
Aye. Thank you.
4-0. Thank you very much. Okay, we can go on to COVID-19 response and updates. Susan, do you want to take that or begin that?
Sure, thank you. So I guess since our last meeting, the main update, the main thing that we've been working on is the reopening guidance. So as you all know, that it's in phases. We are in the first phase right now, and it's a slow process. The second phase may happen in our second week in June, or it may not, just depending upon what the data looks like at the time. So we've been working with the town and how we're going to reopen the town and get everybody back to work in the town. Certain requirements for businesses. You have to be at 25% occupancy, which is one of the things for non-essential services. Right now, for essential services, they have to be at the occupancy by July 1st. So I've been working with the town and town officials, making sure that we have gone through every town building and done everything that we can to keep the employees safe and to meet all the requirements. So that's what we've been busy doing for the past couple of weeks. We're going to be looking ahead. We're still on the CPH conference calls, still on the calls with Maven, and the working with the Massachusetts community tracing team with regards to contact tracing and the requirements for testing and getting off of isolation quarantine. So all of that work is continuing. And moving forward, we will be looking at hopefully getting guidelines soon on what phase 2 will look like, and the possibility of what things can open up in phase 2. So we're looking at that currently right now, and we're hoping to get guidelines from the state on that soon.
Thank you very much. Dr. Saltzman, you have done 12 updates on BCAT. Do you have anything you'd like to add?
Thank you, Mr. Chair. The only thing I'll say is, I monitor the daily Department of Public Health dashboard. We still have a significant number of positive cases from testing noted every day. We had actually, over the past 24 hours, 0 deaths in the nursing facilities in Massachusetts. And I think that's wonderful, given the decimation that the nursing facilities have seen. And our number of deaths are declining. But as I said in my update on Friday, Mr. Chairman, I really want to make sure that our community understands this is still very much a reality. We have done in the state of Massachusetts 545,000 tests, and we still have people testing positive significantly. So I urge our community to continue to take this seriously, despite the pictures that we see from across the country, especially over Memorial Day, where folks are not wearing masks, are not social distancing. This is very real still. I plead that until we have further medical intervention means, hand washing, covering your cough or your sneeze, cleaning surfaces that are commonly used, isolating yourself if you're ill, wearing a mask if you're in public, and social distancing. We have a wonderful community, and I want to make sure that it maintains its health and prosperity. Thank you, Mr. Chairman.
Thank you very much. Would anybody else like to update or provide any other comment? I think we have all spoken quite a bit as part of the town meeting and election situation. I've already made my chairman's report. We're getting there, and we will get through this. David or Libby, anything else? If not, we can move on. Thank you, Susan, and thank you, Wayne. I appreciate it. We now go on to staff reports. Our Christine Mathis, our environmental engineer, is ill. And she is not with us tonight at this meeting. Could I have a motion to postpone the environmental engineer's report?
So moved.
I guess it's Libby made the motion and Wayne second. All in favor, Wayne?
Aye.
Libby?
Aye.
David?
Aye.
And aye is 4-0. Thank you so much. Which brings us to our last, the Director of Public Health. And Susan Luminello represents Christine Pollock, our supervisory nurse. She represents Samantha Hardy. She represents Christine Math. No, she does not represent Christine Mathis. Was there another one too tonight?
Health agent.
Health agent.
And the health agent. She also represents the health agent. So, any questions? First, Susan, is there anything that you'd like to bring forward?
Thank you, Mr. Chairman. There is one thing. I just want the public to understand. The Board of Health, along with the Department of Labor and the Department of Public Health, is responsible for enforcing the governor's orders and what's in the reopening report and all the requirements that the governor's office sets forward for reopening. But there's a lot there, and it is a complaint-based system. So we are responding based on complaints from the public. So anyone can email us at boh@burlington.org, and we investigate each complaint that we get and we will move forward with each one and send it to the right state office if it applies, or we will act ourselves. So I just want the public to be aware of that they can email us with any comments or issues that they see. One other thing I just wanted to let you all know that our masks for the Medical Reserve Corps is still making masks for the public. We've given out hundreds of masks, and we are trying to meet it, all of the residents' needs. We're fulfilling the request probably within a week to 2 weeks, and the number of requests have gone down in the past couple of weeks, but we're still continuing to try to meet the demand that we have. So that is also ongoing. And then I can answer any questions that you have. Like I said, I have been working closely with the town administration and the town facilities department on reopening and getting all the employees back to their offices and making sure that we meet the requirements for office space.
Thank you, Susan. And I just found, and I did review the Marlene Johnson's, our health agents report also. So we have those 4 reports. If anybody has any questions, anyone like to go first? David? For any of the 4.
Yeah, I'm all set, Mr. Chairman. Thank you.
Libby, you have any questions?
No, I'm all set.
Wayne, Dr. Saltzman, any?
Mr. Chair, I was reached out and I spoke to the director about this today by a community member who was concerned about mask wearing by grocery store workers. So they should in fact be wearing masks as part of the governor's order, and I hope that our business colleagues will help us in making sure that the governor's orders are carried out with regard to specific locations identified in his mandate.
Thank you. I have just one question that has to do with something that has come up, and that is the suspension of timelines on hearings and decisions by municipal boards and departments. I guess the planning board has been looking at that. Susan, you had an explanation for that?
Yes, so because we are in a state of emergency, there has been some leeway given with regards to the meeting of deadlines. For example, the planning director let me know today that any subdivisions that come before the board, the clock doesn't actually start 45 days after the emergency is over. So not that we would wait that amount of time, but there is some leeway given in when we need to respond. And that would be for our board and all the other boards as well.
Thank you very much. There are no other questions. Do I have a motion to approve the Director of Public Health report and those she represents?
So moved.
Second.
I have David made the motion and Wayne seconded. David?
Aye.
Well, Libby?
Aye.
Wayne?
Aye.
And aye. So that's 4-0. Before we adjourn, just to remind you, we are on summer schedule unless we need an emergency meeting or a meeting out of that may pop up. But our next meeting is scheduled for the 23rd of June, which is the 4th Tuesday. And with that, everybody, please feel free to call the Board of Health, 270-1955. Please take a look at our website. We have a lot of resources on that website. And with that, I will take a motion to adjourn.
So moved.
Second.
Do I have a second? I have a Wayne second. Before we adjourn, Dr. Saltzman, please note what you always note.
So, folks, safety, number one concern for all of us. Please, 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 what should be a norm in our lives now. Hand washing, hand washing, hand washing is the number one thing we can do to, in my opinion, to beat COVID-19. Thank you. Be safe and be well.
I have a motion, I have a second, no discussion. All in favor? Dr. Saltzman?
Aye.
David?
Aye.
Libby?
Aye.
And I vote aye. That's 4-0. Be safe, be well. Any questions, please call. With that, good night, everybody.
Good night.
Good night. Thanks, Ed.